This is the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Joining me in studio today is Dr. Melissa Dehaarte, the head and the coordinator of the Elderly Health Unit. Welcome to the program, Dr. Dehaarte.
Thank you for having me.
So today we're talking about Alzheimer's, which I know is deeply associated with elderly persons. Before we get into that, tell us about the Elderly Health Department and how you guys function on a day-to-day basis.
Well, the Elderly Health Unit has been around for a while. It's the integral part of the primary healthcare unit here at the Ministry of Public Health. And our main focus or our objective is to ensure that we have quality, preventative, curative, and rehabilitative care for older persons. And when we say older persons, we are looking for persons within that life cycle of ages 60 and older. And in order to implement this quality care, we're having a community-based primary care approach. We're also focused on increasing the capacity of our healthcare workers to better implement our package of essential healthcare services that is provided at all levels of care.
So World Alzheimer's Day is being observed under the theme Ask About Alzheimer's, Ask About Dementia. Tell us, what is the significance of this day here in Guyana?
Well, I particularly love the theme of this year for Alzheimer's Awareness Month and Day, specifically Alzheimer's Awareness Day, which will be observed on September the 21st. The theme that encourages us to ask about Alzheimer's, ask about dementia, encourages conversation. It encourages us to be open, to talk about the illness, have persons increase their knowledge, be more comfortable with talking about it, and share experiences. As we say, knowledge is power. So the more we know about Alzheimer's, what it is, what are some of the things to look out for, and what is some of the interventions that you can have, the better.
Indeed. What steps has the ministry taken to help to reduce Alzheimer's or bring more awareness within the elderly community?
In general, the government of Guyana and the Ministry of Health has been working tirelessly, continually, to ensure that there is the implementation and successful application of what we call a package of essential health services. This means that any health center that anyone would visit or hospital, you will be able to, first of all, see a doctor, get quality care and intervention, and any referrals necessary. Specifically for elderly persons, we would have launched and implemented something called ICOPE, Integrated Care of Older Persons. What does ICOPE mean for us and the elderly population? This gives all our doctors at a health center level and community-based level the tools necessary to identify specific illnesses and needs for older persons. So in general, when you go to the health center or any hospital, they will give you an overall screening for your health, underlying issues. But what about the specific illnesses of older persons, such as dementia, Alzheimer's dementia, persons that may have urinary incontinence, persons that may need special attention paid to their hearing, their vision, all right? Or they may have physical or mobility limitations, such as things stemming from arthritis. So the ICOPE platform gives our healthcare workers the tools to ensure that they capture persons with these needs early and give them the necessary treatments and interventions for not only themselves, but their caregivers as well.
For persons who are watching the program or listening to the program and wondering what is Alzheimer's, what are some of the symptoms, could you tell us about that?
So firstly, I would like to clarify, many persons use the word Alzheimer's and dementia interchangeably. Alzheimer's and dementia is not the same thing. So think of it this way. Dementia is like a category. It's like an umbrella that describes many symptoms that you can find with things that affect the brain, all right? There are different types of dementia. Alzheimer's dementia is one type of dementia, all right? It's the most frequent type with 60 to 80% of persons, older persons, being affected. So Alzheimer's dementia is a type of dementia. Dementia in and of itself is where you have affectations to the structure of the brain, and this results in outward expressions. So let's talk about Alzheimer's dementia. Alzheimer's dementia manifests itself, or you see it happening, that persons have memory loss. It's gradual and it's very apparent, all right? The person will not be able to think properly, rationally. They will not be able to remember themselves and loved ones, their environment, and also it will change their emotions and how they deal with day-to-day living. The person might come more upset. You see them getting vexed and aggressive, all right? And a lot of persons have the misconception that this is the same as old age. Or you'll hear people say, oh, she's just
She's
old.
just getting up in
She's
age.
getting up in age. Or they're senile. Or the person is dotish. I don't like these words. It is important for us to pinpoint what is causing it.
Indeed.
Because you will see a clear difference in what the person used to do and how they used to be and what is happening to them now. So those are some of the things that you could look out for in any type of dementia, but specifically Alzheimer's dementia. A change in memory, a change in thinking, and a change in emotions. And you will see these changes affecting the person being able to carry out their daily functions. They won't be able to function day to day. Simple things: cleaning, washing, cooking, taking care of their pension. And eventually it will get to a stage where they will need permanent help, completely help to do everything. So that's the difference.
So caregivers, daughters, sons, and whoever is probably taking care of their elderly family member, these are things that they definitely need to look for.
Yes, you definitely need to look for these things. Again, let's not just write it off as getting old. For example, if you walk into a room and you can't remember why you walked into that room, that happens to a lot of us. Then when you turn around, then you remember. That's a natural part of
Yes.
aging, or you call it forgetfulness. But the difference is that doesn't get worse over time necessarily, and you wouldn't see a change in the person's behavior, or it doesn't affect your daily life. But things that caregivers should definitely look out for, as I mentioned before, is that change in personality, that progressive and very fast change in memory and change in personality, and the person not being able to help themselves on a daily basis. And how can caregivers better equip themselves? Because I know it is getting more and more frequent that persons are being put in the position that they have to stay home with their loved
Yes.
ones. They may have to hire a caregiver, or eventually make the difficult decision to put them in a care home, or what we call an old people home. So things you could look out for, so you could get the person help early. Early detection and early intervention is very key. We need to educate ourselves on the things that I would have mentioned, knowing your relative and what is not normal for them, all right? And once you get this information, it would empower you to not, what I would say, react poorly to when these changes happen. You will be better equipped with the information. You would have time to plan with your family of how the illness will progress, what financial setup you may need to put in place, what physical setup in the social and home construct. For example, who's going to take care of their daily needs, who they may need to live with. Will we have to take turns as a family to provide medication, take them to the hospital, provide meals? So knowledge is power, and it will help you to plan better.
Effectively.
Yes, and it will help with the strain and stress that you may feel as a
And
caregiver.
burnt out.
And burnout.
Yes. How long does Alzheimer's take before it actually develops and become or get to that worst stage? Is there a particular age that this usually come about, or it's progressive along the time?
Yes, so you did use the correct word there. It is progressive, or as we would say in our Guyanese terms, it happens little by little. Little by little. Unfortunately, you would not recognize it right away. But as to what age you would see it at, it depends on how old the person is when they're first diagnosed. It also depends on if the person has any illnesses before, or if they have any sicknesses like high blood pressure, high blood sugar, that may cause a faster showing of the dementia, Alzheimer's, or it may happen a little slower if the person maybe is healthier. All right. However, whenever the person is diagnosed with Alzheimer's or any type of dementia, how fast will that progress? Again, it depends on the person's present state of health. It depends on the support they get from the environment in terms of the proper food to eat, medical intervention, and their social setting. Research shows that at least persons that have been diagnosed early can live from up to 4 to 8 years extra to their current life expectancy or what you would think they would live up to. Or you have persons, depending on the quality of care that they get, they can live up to 20 years more. All right. So again, it depends on the current status, health status of the person when they have been diagnosed.
Thank you, Doc. You would have spoken about the health factor there, which is very important. And you also spoke a little bit about lifestyle. Tell us the importance of lifestyle, good, healthy lifestyle practices in preventing Alzheimer's.
All right, so I will speak of what we all know and what many of us don't like to hear. Diet and exercise is key. Lifestyle means what are you doing every day that will keep you mentally, physically, and emotionally strong. And remember, the overall goal is quality of life.
Yes.
As we age, we want to have a good, comfortable life. We want it to be of high quality. So let's start from the basics. From the time we start to educate our children as to what to eat or how to be active and the examples that we show at home, the foods that we prepare on a daily basis. Do you go out and walk? Make sure you don't drink, you don't smoke. And even when you eat, it is better that you prepare your own meals. We want to have healthy meals. We want to have meals in the right portion. All right? As you age, you require different nutritional elements. All right? We need to ease with the sugar. We need to ease with the provision. All right? The chow mein and these things, the things that we love.
Yes.
Everything in moderation. A little bit of everything is always
So,
good.
Doc, is it possible for our elderly population to still be able to enjoy the nice foods, but prepared in a more healthier way?
Definitely, definitely. Persons love to have juice. You can blend your own natural juice. Instead of putting a lot of sugar, put a little bit of honey. Or add fruits that are already sweet, such as pineapple, apple. So you have bananas, you make your shake. So you have the natural sweetness and you don't have to add sugar. There are many meals that can be prepared, and this has been advertised and encouraged by our nutritional department and chronic disease department, that you can use your fresh seasoning. You blend up your nice garlic, onion, thyme, etc., and you add that to the pot. You don't need heavy salt and packet seasonings, all right? I do know many caregivers may say that their family might complain, the food fresh or it brackish. All right. Everything doesn't have to be sweet. All right. And as we age, our taste buds kind of go away a little bit. So we have to work to find that balance. All right. And it is important that we find balance. It is occasionally you can have a little bit of a piece of cake or whatever your heart desires, but everything in moderation. And let's keep the sweet and fried foods for special occasions, as it was meant to be, not a daily thing.
Indeed. I like the fact that you mentioned moderation, because I know us here in Guyana, Guyanese are accustomed to their huge plates of rice and stew and all these things,
Exactly.
but we need to have everything in moderation.
Yes.
I will talk a little bit more about Alzheimer's when we get back from this short break.
Hello, my name is Dr. Melissa Dehaarte. I am the coordinator for elderly health at the Ministry of Health. We are in the month of September, and September is Alzheimer's Awareness Month. And within this month, we are working with the theme, No dementia, no Alzheimer's. And within this campaign, which will be international and worldwide, we're focusing on empowering caregivers with the knowledge about Alzheimer's. Having knowledge is power, so we should know what are the symptoms and what to look out for and where to seek help. There are some basic symptoms that you could identify in your loved ones, such as memory loss, not remembering the name of persons or objects, aggression or mood changes, sadness or depression. If you or anyone you know, elderly persons over the age of 60, are experiencing any of these, you can feel free to reach out to your closest healthcare provider or health center, which will guide you on what is needed for the health and well-being of your loved ones. Remember, knowledge is power. Let's take care. Hello, I am Dr. Dehaarte, the Coordinator of Elderly Health at the Ministry of Health. Let's talk about medications. As we all get older, unfortunately, some of us may suffer from chronic illnesses, such as high blood pressure, high blood sugar, and as a result, we may have to take medications. What are some important steps to ensure that you get the full benefits of your medications? Make sure that you have proper storage. So, we must set aside our medications daily. They are available pill boxes which have the days of the week, which will help to sort your medications and you wouldn't forget. Or you may keep your medications in the pre-sealed packages received from the health center, clearly labeled, which will guide you. Make sure to set a reminder. Set a phone alarm. Use the almanac. Have a relative remind you. Some way of remembering to take your medications on time. Make sure you know which medications go together. If you take medications that do not go together, it may be too strong and overwhelm the system, causing many side effects. Ensure you're clear from your doctor which of your medications must be taken together. Additionally, you must know when your medications are expired. All medications have expiry dates. Please check and ensure not to take expired medication, because if the medication is expired, you will not get the benefit of the medications. Know which medications require you to eat or drink before taking them. Most medications require you to take them on a full stomach, but this is not always the case. Please find out from your doctor if you should eat before or after taking your medications. This is very important. And lastly, look out for side effects. Many medications may have side effects that may be tolerable or intolerable. For example, in the elderly, you may have, when you take your medications, dizziness, abdominal pain, nausea. Look out for these side effects and immediately let your doctor, healthcare provider know so they may provide an alternative or a change in medication.
Welcome back to the program. For those of you who have just joined, today we're talking about Alzheimer's, recognizing the signs and symptoms protecting our loved ones. With me in studio is Dr. Dehaarte. Dr. Dehaarte, we were talking about lifestyle practices, good healthy lifestyle practices to prevent Alzheimer's. And I want to talk a little bit about diagnosis. Is there any form of screening that persons can undergo to see if there's any, signs or symptoms of this disease coming on?
Definitely. First, let me say, unfortunately, there's no cure for Alzheimer's or any form of dementia. However, based on our robust primary healthcare system and tertiary healthcare system, there are screening interventions in place that will help us to have early detection and screening for Alzheimer's or any other type of dementia. Specifically, Now, with the implementation of our ICOPE screening at all primary healthcare institutions, they're equipped with the tools to have early screening of elderly persons. And what would this entail? At any health facility that you go to, not only would you be able to see a doctor, but you will have a full workup from the ground up, entailing the person's blood work, their height, their weight, etc. More specifically, as the doctor gains their knowledge, they will be able to use those tools to screen the person for any cognitive impairments. And what does that mean? Are you having affectations in your memory? All right. Has your personality changed? As we spoke before, is the person becoming more worried, anxious, depressed, etc.? So once they would have been able to gather that information, is the person's daily living being affected? That is key. Once one is not able to take care of themselves, is a big red flag that something is causing that. Essentially, we always walk or we always try to work with baseline information. Do you have high blood pressure? Do you have high blood sugar? Are these things being controlled? Are you eating well? Are you taking your medication? Because these things can contribute to you either having Alzheimer's dementia or it getting worse. All right? So we have our professionals that are able to follow that line of screening. Additionally, we do have within the tools provided the opportunity for our healthcare providers to be able to ask questions about the person's social environment, what may be affecting their mental status, if they're depressed, if they're anxious, and their physical capacity as well. All right. Do we have elements in place that is of preventing them from moving around freely, to be able to prepare their meals, to visit the health center, to get their medications, however it may be needed. Additionally to that, the ICOPE program has set out a roadmap where persons are able to age in place. And what does that mean for the screening process? Not only are persons screened when they come to the health center, but now you have strengthening of home-based care. We call it home-based care. So persons that are shut in, bedridden, or otherwise unable to come to the health center, we have our healthcare professionals that will go to the home and screen those persons, check their blood pressure, blood sugar, see if they're being able to keep up with their medication, if they can afford the necessary foods or nutritional elements that they need to have to ensure that they're healthy. And if any elements of this screening is found to be inadequate, we then follow a process of having them follow up with the doctor, strengthening those things, or referral. We work closely with our partners at Social Protection, and they have a lot of assistive programs for persons that may have constraints in finances or support that they can be helped.
The collaborative support is definitely needed, and we understand why. After diagnosis is done, after we're finished with screening, what happens next? What can caregivers look out for? What can they do to help support the process and support their loved ones?
So the next steps are key. They are essential. Many a times persons go to the health center and the doctor will tell you, okay, for example, your loved one has Alzheimer's or dementia, and they will refer you to specialized care. We do have specialized care as part of our health system. For example, at the PALMS, we have specialists there, geriatric specialists, that will be able to give further assessment on the person's mental condition, their forgetfulness, their aggression, and their inability to take care of themselves, and fine-tune what is needed and what medications need to take. It is good to know for persons in and around Georgetown that the PALMS is open to walk-in elderly persons, I do believe Tuesdays, Thursdays, and Fridays. That can be verified. Additionally, we do have the support of our mental health unit at the Ministry of Health that is channeled through Georgetown Public Hospital, and they are also capable of screening and giving professional care for Alzheimer's. So the first step for a caregiver is to ensure you follow up, and when that referral is given, you follow through. to make sure, like we said, the key is early detection, early prevention, early treatment. Speaking of treatment, the caregiver should know what to expect. Like I said, there is no cure for Alzheimer's, but there are medications that could help lessen the symptoms and could help the person to have a better quality of life. All right. So if there is the presence of aggression, change in personality, depression, or any of those symptoms, medication can be given to help the person to be more comfortable, more calm, and to have a day-to-day existence that gives a better quality of life. And it will also help the caregiver not to have to stress as much with the changes in personality of that person. So the caregiver should firstly follow the instructions that are given and broaden their knowledge a little bit more and read up about what to expect within the realm of what the changes that would happen with Alzheimer's.
Indeed. I know the elderly patient might experience quite a lot of challenges, and knowing that you have or is dealing with that disease, it can be a bit tedious to that person. However, the caregiver too will experience challenges. How can they deal with those challenges in a healthy way where they can be balanced to better take care of their loved ones?
I must say it is a difficult road. It is not easy whatsoever. And many caregivers out there that may be listening can attest to this. It is a daily challenge. So caregiver burnout is very real. You will get tired, you will get fed up, you will get upset. So like we've been mentioning, you need to understand that a person that has dementia, Alzheimer's, or any other type, they're not deliberately being difficult. From the time you understand that, you will be better able to confront any episode that the person may be having. Self-care is essential. As a caregiver, you need to ensure that your own health is put first. Because like we would say, if you don't help yourself or take care of yourself, you can't help anybody else.
Correct.
So if the caregiver of themselves has an illness, high blood pressure, high blood sugar, they need to make sure that they're taking care of that illness, eating properly, taking their medication. Also, we need to come together as a community. All right? So it takes a village. You need to ensure you have breaks. All right? If you can have a family meeting and organize and say, okay, who's going to take mom or dad to the clinic? Who's going to get the medication? Who's going to prepare the meals? And you
Sharing
divide
of
those tasks.
responsibilities,
Yes,
yes.
you share those responsibilities. And once you are able to accomplish that, you as a caregiver will not feel overwhelmed or overburdened. There is such a thing as caregiver guilt. Some persons feel that they have to do it all, that they shouldn't leave the responsibility to anybody else or step aside. That is not the right attitude or the right way to look at it, all right? We all need a break and we all need help. So those are the essential things that caregivers need to know. Self-care, building a community or a network that can help you, and continuing to edify yourself or get knowledge. The more you talk to other people that are caring for loved ones, it doesn't have to be an older person, but anybody that is providing care, the more you have those conversations, it would help you to get resources and get advice.
So finding community is important.
Very important.
And it provides support as
It
well.
provides
Thank you
support.
so much, Dr. Dehaarte. Before we wrap up today's program, do you have any final words of encouragement to our listening and viewing audience?
So my final words of encouragement are to emphasize this year's theme. Talk about dementia, talk about Alzheimer's. The more we have these conversations, we will become more comfortable and have the knowledge we need to deal with our day-to-day difficulties. Anyone can have an elderly person that will need their care. Anyone can encounter someone with Alzheimer's and dementia. Let's have the conversation. Reach out to your closest healthcare facility and have that person screened and get the information that you need.
This was the Health Matters program. Thank you for staying tuned with us. I'm Alicia Martin. Goodbye for now.